We need to stop saying that depression is not a weakness when depression is clearly a weakness. Depression is a mental illness that affects a person's ability to function. Depression is a mental illness that affects a person's ability to take care of themselves. Depression is a mental illness that affects a person's ability to work or to work productively. Depression is a mental illness that affects a person's ability to cope with the life challenges they're facing. And so depression is an illness, limits the person's ability, weakens the person's strength, which they would normally have to be able to carry out their day-to-day activities. Now, our effort to try and destigmatize depression must not come at the cost of misunderstanding what depression is. And once we start allowing that permission for people to recognize the limitations that depression as an illness brings to them, then the person will begin to acknowledge themselves as a sick person and assume the sick role. And the sick role comes with certain rights and certain obligations. For example, a sick person, they have a right to be exempted from responsibilities because they're not able to function. The same way a person who has a flu and is coughing all the time may not be able to productively work. It's the same way a person with depression experiencing extreme fatigue all the time is not going to be able to function. They have another right where we say that a person who is sick is not responsible for their illness. So a person who has depression, it's not their fault that they have depression, and that has to come out very clearly. But also the sick person, in this case a person who's depressed, they have obligations, they have responsibilities. A person who's depressed must try to get better. And if they're not able to, then they should seek professional help to try and get better. And so if we can start having these honest conversations about mental illness being a disease that affects a person's ability to think clearly, depression does that. It affects a person's ability to think clearly. It affects a person's ability to see the reality rationally and accurately. Depression affects a person's ability to regulate their emotions. And so a person who's depressed is irritable. They're easily angered, easily frustrated. A person who's depressed may feel worthless all the time. A person who's depressed may lose their ability to control their impulses. And so their behaviors might be difficult to control because of the depression. And so once a person is able to acknowledge these symptoms as limitations to their ability to function, then they can ask for help. But if we say depression is not a weakness, then why is the person seeking care? But if we admit that depression does affect a person's strength, does affect a person's ability to do what they normally do, and so they're weakened when they're depressed, then that should give them permission to go and seek the care they need to get better, to be able to restore their mental health.